Thank you, Madam Moderator. First of all, I would like to apologize. I have a cousin who is a doctor and endocrinologist sitting next to me, and he's sticking to me. You know why? Because he's checking my blood sugar. And as a result, I've lost most of my sight. So today, after 52 years of lecturing, I'm going to read from a paper. So I apologize for that. Today, first of all, I'd like to thank Madame Son, my friend of many years, for inviting us, and also Sheikh Khalid for being here, Your Excellencies who are around, friends and colleagues. I'm very happy to be here today, and I would like to thank the organizing committee, including Dr. Mull, for helping us to come here, and it's been superb arrangement and perfect hosts. I'm not going to give a lecture today. I decided that at 4 o'clock this morning when I was having a shower. What I'm going to do is just going to put facts, and I'm trying very hard to be a devil's advocate so that you can go out of here and think of the facts I'm doing it. And I only want you to ask yourselves one question: why we are not there? Why the countries in the global south, most of them are very, very rich, and yet they are very poor? Why is that? So you have to think of that and reach your own conclusion through Google or through anything. This is what's that? I was surprised. I looked like the first slide was Dr. Khalid. I'm what I am, unfortunately, and I've been in business for many years. Thank God for that, and I'm glad that I'm still standing because I have a perfect wife. Oman Cancer Association and Qatar Cancer Association think alike. And for that reason, between myself and Dr. Khalid, we decided to twin. And we work together for reason of no duplication of work, and to work so as to work for our patient. As he repeatedly said, we don't want top institution covered with marble. We want results on how we can help our patients. And that's the most important thing. What I'm going to talk about is to cover what us as NGO are before pandemic, because I'm asked to talk about post-pandemic care of cancer in Asia. I'm not going to limit myself to Asia. I'm going to talk about Asia, I'm going to talk about Africa, and I'm going to talk about the Emerald region, which is all full of trouble, one way or another. And if we don't agree that, then we are living in cuckoo land. So I'm going to talk mainly about the global south, a region that is very rich with super intelligent people who go abroad and do innovations even though without being recognized. And I'm not going to be political, and I don't want to be political, even though I've been an ambassador for 10 years. But I want you to think about it, why we in Global South are in this position. We tend to complain our government doesn't help us, our government is not doing this. It's not our government, it is ourselves. And the example is Oman. Oman, we have a very benevolent government, a benevolent king, Sultan rather, not king, because Sultan is bigger than the king. And Omanis are being given free treatment, just like in Qatar. But why we are not reaching there? That's a question we should ask us Omanis. Why we are not being very successful? We are successful, but why not very successful? Because we tend to blame people. And we tend to look at the cancer patient. We are not looking at the family. Everyone, oh, my friend has cancer, my relative. What about the family of that patient? What future do we have with that family? What future we have with that patient? So basically, these are the sort of things I would like to talk about today. and to think about it when you go home. Don't think of me, think of the questions. So I will try to define pandemic, because pandemic is anything. There are a number of institutions globally recognized describing pandemic: WHO, Webster Dictionary, and the International Patient Association. What I think pandemic is suitable for our talk today is what's on the slide. Sorry, I'm not used to doing this. No? How do you go back, Jessica? I think you better sit next to me and I say next and you do it for me. Okay, this is the definition we will use. It's an epidemic that is crossing the international lines. But we have to realize before we discuss about post-pandemic, we have to discuss about the disease cancer. Is it a pandemic or not? I don't know how many of you agree that it is a pandemic. I think it's a pandemic because it crosses all the international borders. And it is not solvable, not because it's a bad disease or it is expensive for the moment to deal with it, but because we ourselves, we are not doing anything about it. Or what we do is very limited. Or what we do is not directly for cutting down cancer and helping cancer patients. So that's, next please. What I would like to talk about now is examples of cancer burdens. One, globally, let's take children's cancer. In the United States, I know we cannot compare Malaysia or Asia with the United States, but for every 5 patients who are diagnosed, the children with cancer, 4 of them get treated. That is 80%. Are they better than us? I don't think so. In fact, I think we're better than them. In the rest of the world, 400,000 children every year are being diagnosed with cancer. And how many are treated? 1 in 5, which is 20%. Ask yourself why. Are our children less human or what? So that's what we need to think. WHO has committed by 2030 to have 60% of children to be treated, please, of our country. As you can see, with Iraq, we did a study, and we were expecting that in the next 10 years, between 2010 to 2025, by the way, it's not 10, it's 15 years, we expected that there will be double in the number of cancers in Oman. No. Look at the graph, it is nearly treble. Why? It's Cancer Association and the government of Oman is not doing anything for cancer patients. We are doing, but we are not doing enough. As Sheikh Khalid said, we are not talking about the rosiness of what we do. It is hard, it is difficult, and the main thing we realize very lately that unless we work together, we cannot fight cancer. That's why we twinned between Qatar Cancer Association and Oman Cancer Association. We work together, we help each other, and we don't duplicate things. And this is the most important thing. Why doesn't Qatar and Oman work with Malaysia? In programs, not in being partners, in programs, in different types of programs, so that we can reach to the community and we can reach to the public. And this is the most important thing. Next, please. We are going to talk about cancer now. I finished with the pandemic. Now we believe that cancer is heterogenic disease. Why? Because we started understanding oncological genomics. If you take a mass in a human being and you take a sample at the top of the mass and you take a sample at the bottom of the mass, you will find 2 different genomes. And that's why on-shelf medication does not work. And it is very expensive. But not only expensive, the patient suffers because they are not getting treated. So with genomic now, we realize we can help our patients to give them targeted therapy, which makes them better, and also patient personal care therapy. So you are being treated by the body your body can take, which is most important thing. And this is what we should now go about. Now, in Global South, can everyone have a genetic center? No. So what should we do about it? We have to think how we can share our resources. So if Malaysia hasn't got, I'm sure you have a genetic center, I'm just using Malaysia as an example. You do not have genetic facilities. You send your patients to Qatar or to Oman, and we do it for you, even though we run the risk of security, because no country wants to give another country the biological genome because it could be used against it. So we have to find a solution on how to go about it, and this is very important. Next, please. What we're going to talk about now is the requirements, pre and post-pandemic. And I'm going to be very, very tough, and I hope I won't offend any country or any person, because I'm not talking about Malaysia, I'm not talking about Middle East, I'm talking about Global South, which is what we are trying to do to change things. So number one, we need national programs, and they should be very intensive. These national programs should be, especially if we start with the very common cancer diseases like colorectal and breast in ladies, or we start with thyroid and lung cancer as it comes nowadays, and we make sure that we follow and get data so that we see how we are progressing with the awareness and advocacy program. We just don't go talking to people, but the data is very important. Like take the country like Oman, which is very big, like Malaysia, which is very big, especially divided Malaysia by an ocean. So we have to find a solution to get the data correctly, and data can only be received if we end up with digital technology so that we can get information and we can get numbers so that we can place our advocacy and awareness group in order. Number two, I told you I can't see properly nowadays. So soon I'll come to Malaysia for retinal transplant. Education for all the sectors. And as I see that on my slide, I put education, education, and education, because I cannot stress properly the amount of education we need. People said, oh, they don't do it, they don't understand, or they are bad, they don't want to help. No, because they are not educated to the importance of cancer. If we educate them, they will come around and work with us and deal with us. And therefore, education is important. And that is not only to the community, but to the stakeholders. And stakeholders, I mean the decision makers, our government, and head of the corporate companies to be ready to help the NGO so that it can have enough resources to work. So if there is no education, there is no support. Number three, empowerment. We have to empower the patient. A lot of patients are treated and they go back to their life, but they are not socially reintegrated. Reintegration comes with empowerment. So if you empower a patient, you reintegrate him back to the society and to be helpful to other cancer patients and to be helpful to us, NGOs, to create a stronger advocacy and awareness group. So empowerment. And I would concentrate here on ladies because they are the pillar of our society. And when you empower a lady, she will make sure that the rest of the family does not go what she has gone through. And that's very important because the family always suffers more than the patient. In what way? The mother is not there, the children don't go to school, they don't do their homework, they get into delinquency and into trouble. And we don't want that. But that is what is happening in all over the world, not only in the global south. The other thing is, next please, address the community at local and national level that cancer is not a killer disease. I heard Sheikh Khalid and I heard everyone talk about that disease. Why? Because we did not educate these people that if you get treated early, cancer gets cured. I have a wife, alhamdulillah, I have a wife, who is a 4-time cancer survivor. Why? Because she was diagnosed early. And since she was diagnosed, the first one was in 1999. So if we tell people, and she goes out, and she still goes until today, talking to the public, look, I'm fine. I had 4 cancers. So people will go and have their breast looked at, they will have their colon colonoscoped, etc., and their thyroid being tested. So we have to find a solution on how to talk to the community that cancer is not the other disease that kills. That kills because before, 90 to 95% of the people had stage 3 and 4. So there's nothing we could do about them and they die. But now, Oman, through our breast cancer awareness program and using mobile mammography unit, we decreased breast cancer 3rd and 4th stage from 85% to 30% over the last 10 years. And because we went to the people, and at the beginning, she herself went to the villages and said, here I am, I had breast cancer, and I got early diagnosed, and here I am talking to you. So the villagers accepted that. But if I go and talk to them about breast cancer, the ladies won't even want to talk to me. I said, who are you? Go away. So that is the way how to approach people to get your program work. Number 5, rather, role of NGOs and civil society. We have to explain to our government, which is very important, that our role as NGO is not to fight them or to undermine them. Our role here is complementary to the social and health societies and health issues of our country. We are here to help. We are here to fight with you in times of peace and crisis. And that's the only positive thing that has happened in COVID in some countries. The only thing positive. Everything was negative. But in COVID, some countries, as Sheikh Khalid said, we worked with the people. We did the job that the government was supposed to do when they were very busy with hundreds of people in their hospitals. And they had canceled the oncology appointments. And it was the NGO that made sure that we keep in touch between, on this side of the table, with the patients and the government and the Ministry of Health in particular. We made sure that they got their appointments because they were not allowed to go to the hospital as part of lockdown. So this was, in my opinion, it showed that we can do something as NGOs. While in other things in COVID, it didn't. So the whole time of COVID, we did our awareness programs, we did our mammography unit. It cost us a lot of money because our radiographer looked like she's in space, covered totally from head to toe. And every patient that went into the vehicle, she had to change. So that cost a lot of money. But we had to do it. We cannot tell people, don't come because of COVID. And that's the situation. The other thing is working together. We can talk, we can meet 10 times a year and talk about the same thing. But if we don't work together on the ground, we wasted that time. The money we spent on the conference, which are very relevant, should be spent on the patient if we don't do what we are supposed to do and we just end up talking. Or everyone, after 3 days, takes a plane and goes back to their country, or the local people go back to their job, and they don't think about how to work together. We have to work together. We have to find a pragmatic solution in working together. Otherwise, we are wasting our time. And we're not doing our patients any good, in my opinion. But my opinion is always trouble to some people. Okay. We have to face the challenges. We have to address the community. What are their challenges? I'm sure here in Malaysia, you have different communities with different challenges. So how can you take a challenge in community 1 to deal with community 2? You have to go and engage with the problems of the community and deal with it accordingly. Otherwise, it's of no use. And that's where most of international bodies are failing, because they are thinking only of the few people on the board, and they don't go, as Dr. Khalid said, go down to deal with the public. You have to deal with the public so as to be able to do something useful. Now, next please, slide 10. We found that post-COVID, a lot of negative impacted issues happen to cancer patients. And the reason being that there is a paradigm change in the triaging system of the country. In COVID, everyone was talking about going to put things in your nose or in your throat. And in wards, everyone is looking at how to treat people, and cancer was left behind. And this is where we were wrong. I'm not saying this is a mistake of WHO. I have great respect of WHO, because at one time I was a consultant of WHO in Geneva for global road safety. So I know that they are working very hard, but they have got a lot of constraints and a lot of different countries to deal with. But we have to deal with our problem. You cannot expect your neighbor to deal with your problem in your house. You deal with it yourself. Therefore, we have to address our people in our countries and share that knowledge with the others so that we get corrected, and at the same time, we help our neighbor in what they are supposed to do. We have many challenges post-COVID. Number one, resource allocation. NGOs were happy before the pandemic because we used to get resources from a number of places. As Sheikh Khalid said, we treated X number of foreigners, as the question was, from Sri Lanka. All the patients in our country, the Omanis, are treated free by the government, but the non-Omanis are not. So we tried to raise funds for these people to be treated, and we are facing the same problem as Qatar is facing. We cannot keep statistics. And now what we are doing, and I'm sure Qatar will do with us, is to approach the foreign affairs to deal with this problem. In Oman, we have taken a slightly different approach. As men cannot think, we work with the wives of the ambassadors. And yes, and you'll be surprised how much it has been helpful. The wives of the ambassadors say, look, you are responsible for your community in this country. Please find out what their problem is and let us work with you. And now they are working with us, the wives of the ambassador. In fact, they told me last week, we meet every month once, said, you know, in Oman, there are 9 female ambassadors. I said, I wish all of you, all the ambassadors were women, would have gone forward with our life. So he said, we have to meet with these 9 ambassadors. I said, you are the wives, you can't talk to the other ambassadors. I said, it's better than you go through the foreign affairs and get them to sit with us. And this is the situation. Let alone sit with us and talk about cancer. Sit with us to see what we can do for their country who are in Oman. So this is number one, resource allocation. Number two, delayed diagnosis and treatment, which we just talked about. It's very important because of the lockdown. Cancer patients who are not treated and even diagnosed. So we have to use our services in certain cancers to diagnose and then get them indirectly to see, especially ladies with breast cancer, to be seen immediately so that we don't have problems with that. Number three is rebuilding networks. Dr. Khalid directly or indirectly said about the work, hard work there is. The hard work is for an NGO is to build a network. Now, if you have a network and then it is destroyed by pandemic, rebuilding that network is a big problem. And most of the problems post-pandemic depends on this destruction of the network between the NGO and the country it's working. Addressing the backlogs. That is nature. I don't have to say much about that, because if you have a breakdown and you don't have diagnosis and you don't have treatment, you have backlogs. So you have to find an innovative solution of doing that. The next one is sustainability. How can you sustain your NGO if you don't have money? Why you don't have money? Because during pandemic, all the money was directed to the Ministry of Health to buy stupid, and I apologize to WHO, vaccines, that half of them, after the pandemic was dug in our country, we dig a big ditch in the beach, and we put the excess vaccine in burying them. And this is the reality of many countries. Some of you don't know about it, but it is happening. And let's be frank about it. So sustainability means that we have no money even to pay for the staff which you have. And you can't throw people out because you don't have money. So what I did, the board members all had to pay. And there's a gentleman who is a board member who had to pay half of his salary to pay salaries to the people working, because that's how to do it. Otherwise, you can't do it. Next one is addressing the mental health issue. Can you imagine? We are talking only the mental health issue of refugees, and we don't have in our country. We have from Sudan, from Syria, from Lebanon, from Iraq, from Libya, but they are not in refugee camps. But they are refugees and their income is not that much. But addressing the mental health problems on these refugees and as a result of pandemic. What does the NGO have to do? We have to reorganize ourselves, expand our services, get into training of people in health to deal with mental health diseases, or whatever you call it, so that you don't offend the person. And that costs money. And you had to do a lot of additional training, and you have to find more resources, which normally an NGO doesn't. And we are only dealing with cancer patients. We are not dealing with mental issues of the rest of the population, only on health patients. We have to work very hard, pre and post-pandemic, about policy change. Why we have to do the policy change? Because policy changes to address the system failures of our countries. And we are not here blaming politics, or we are not blaming. I was an ambassador for 12 years, so I know what the government is going through in helping people of the society. But we have to, there are deficits. And as Sheikh Khalid is very successful in Qatar, thank God for that, because they get into solving the deficits in the health system and in the infrastructure of the government health service. And we have to do it very carefully so that you don't upset your friend, the Minister of Health. So that's it. Adapting to digital health. I know nothing. I don't even know how to deal with my telephone, my mobile phone. If I'm stuck, I call my 5-year-old granddaughter to show me. So I cannot claim that I know how to deal with the problem. But our people had to learn digital health and had to introduce digital health as far as cancer is concerned. And we have to invest in technology, infrastructure, and also digital literacy program. So we have to bring also the people. We have an app that talks about palliative care, and we get people to know who are in palliative care who are not registered with us through the app. So it helps. Manpower and volunteerism. This is also has been very much affected as a big challenge for pandemics. So we have to work into manpower, and we have to work in the challenge in the what you call staff and etc. What are the realities? The realities will upset some people, but I apologize. And don't ask me questions about this, because today I did not bring next to me my driver who answers all my questions for me. So very few questions, please. Pardon? I can imagine from you. But I will talk here not about Asia, I will talk here about the global south, which is very important. And please think of the global south, that this is our only salvation. Why should I want an expert with blue eyes when I can have an expert from the global south? Why don't I trust him or her to teach me and to teach my other people? So these are very important things. Let's talk about global south in everything we say. So we have in all our countries, including Oman and Qatar, I can speak for Qatar because we are twinning now, we are one, limited awareness and advocacy problems. So we have to increase them and work with our people. Instead of me working with United States, let me work with Asia. Let me work with Malaysia. Let me work with Singapore. Let me work with China. So that because, why is that? Because we have similar cultures in countries that are multi-racial and multi-religious. But we have learned to live together and to work together. So our way of dealing with things are very similar than to bring someone who does not understand our culture. How can I talk to a young lady about breast cancer if I don't understand the culture of the country? How can I arrange a man to treat a secondary school girl in Oman, where breast cancers are very common in secondary school at the age of 17 and 18, to go and train secondary school girl to do self-breast examination? In other countries, it's okay, but in our cultures, it's not, irrespective of the religion you believe in. So these are the sort of things we need to increase our awareness on. Lack of diagnostic, treatment, equipment. I was born in East Africa. I was born in Zanzibar. I went, and I don't know why, probably because I'm crazy, I went to what they call oncology center. I could not get into the female ward because all the women had fungating masses and infection. And when I asked, they said, we have no way to do mammography. We have no way to treat these people. We don't have specialist surgeons to work. So what did we do? We have to find solution on how to give them diagnostic and treatment equipment. But there is no point of Oman or Qatar or Malaysia to send this equipment to these countries because they don't have anyone to run them. So what's the use of them? So I learned that the only way is to go and do training of their people in their country. Instead of bringing them to Oman 2 or 3, we go and train them 50 at a time for 1 week. And now they have manpower. And this is what global institutions should do. Go to the ground and see what they can do with the countries. Human resource development of healthcare professionals and healthcare givers. We still have doctors who call themselves oncologists, and they don't know even how to address a patient. They see a mess, oh, this could be cancer. As soon as you mention the word cancer, the woman goes to 7th space, or the man goes to 7th space, and the whole family is disintegrated. So we have to teach our healthcare providers everything, including talking to the patient and talking to the family. We have to teach them how to talk to the healthcare givers and have to help them. And this is very important. And talk to the community. But here I'm I spoke this to Dr. Su, my friend, yesterday. I'm very sorry that Malaysia has come out with a perfect program to look at holistic approach to cancer awareness and cancer prevention, and that is through the primary healthcare physician. They put the program, but when I ask her, it's not functioning. Why? That's why go home today and ask yourself why that program is not functioning. No need to blame the Ministry of Health. It's ourselves to blame. I am trying to get primary healthcare physicians to be responsible for cancer awareness, to be responsible with our institution, our association, to look after patient care. We had a lot of patients who were told that the doctors told me I have to do genetic testing because it could be familial or it could be know how to treat me better. So there is a genetic center, but the machines are 30 years old. So we are told to go to the private sector, and they were charging us for the test around 5,000 riyals. So I got the board, and I got Dr. Mohammed, thank God, he's going to talk about it, to look into it. And we found that the only way is for the association to fund the government hospital in the genetic center to put genetic machines to give free genetic testing to our cancer patients. And that's what we did. And this is what's important, because we can give targeted therapy to the people, we can give personal patient care services, and not only save the patient from pain of failure of treatment, but we are improving the budget of our country. I mean, in Oman, because we give free service to the patients, it costs the government 20 million, that is $52 million a year, just for chemotherapy. I'm not talking about the patient and the hospital, etc. So this is the problem that we have to do. Now, can everyone in Global South have a genetic center? No. So why don't we work with one or two countries as separate, together with Qatar, together with other countries in the Gulf that have genetic centers, to look after patients from this part of the world? Again, we have to talk about the role of NGOs and how important they are. Access to remote areas. Do we have enough access to remote areas in Global South? No. Why? We need to improve that. We need to tell the medical companies who build, they don't build, but they make the chemotherapy for 10 riyals and sell it for 3,000 riyals. They have to help us to help these low-income middle countries to have access to remote control through digital services. Research funding. Every country has to put 8% of its GDP to research. I met so many researchers in 24 hours, but how much these researchers are working with other countries, I don't know. I'm not here to comment on people's, but if the country gives 8% of its GDP on research in everything, and from that 8%, 2% on cancer patients, we will solve cancer problems in the next 20 years. I bet you. Finding ways of bridging the gap. Everyone talks about cancer gaps, but what are we doing about it? That's why I'm telling you I'm being a devil's advocate today. Realizing and appreciating the role of NGOs, I've mentioned that, it's very important. Political will. If you mention the word political will, they don't look at the word will, they look at the politics. But we are NGO, we are not government. Why should we look at the political will to change the way our patients are dealt with the common system in the country? For example, in our country, you are sick, you are given 6 months full pay, 6 months half pay, and 6 months no pay, and after that you are given a kick in the butt. Now, can you tell me that the cancer patient can be okay in 6 months? The treatment is enough for that? So we have to go and say, look, cancer patients should be taken out of that because they have a family to feed, and that's very important. Anyway, I just want to make one slide, then nearly I will be over. I know you are tired listening to me. The refugees, as I said, there is a paradigm change. We are the lowest part in the refugee camps or in the refugees with cancer management. Accessibility of treatment is very low due to lockdown. Social, physical, and mental, creating more reason to have cancers for those who would not probably have cancers if they were not in the refugee camp. And it's something we have to think about. What are the solutions? I think the United Nations is not as important as we thought before. But I'm not here to talk about United Nations. But we have to make cancer, next please. We have to make cancer a strategic disease, because if it's a strategic disease, every government will have to sign if he's a member of the United Nations. And therefore, our cancer, when we talk to them, they will listen to us because they have signed to commit to strategic disease. Accessibility and follow-up intensify the awareness and advocacies. We talked about that already. But political will, we talked about that. Strengthening the role of volunteers. We have volunteers to lift boxes and to do this, but do we educate them in cancer? And that's the question we have to do. NGOs alliances. This is where Dr. Khalid talked about ICPC. We sat down ourselves in Qatar and we thought that we have to help low-income countries, not even low and middle-income countries. And the only way is to form an international consortium, not organization or committee, a consortium, that everyone is treated by its own identity and cultural issues. And we go and help them in their countries to educate and to see what their need is. We are now even thinking of starting an award system by getting rich countries give scholarships to young people who are in front of me to go to these different countries and write report about the deficiencies of that country so that we can support them accordingly. Sharing, I've talked about it. And the most important thing, social reintegration of our cancer patient. It's very important for that. I would like to, next one please, talk about the Oman Cancer Center. And I'm sorry, but she is a great lady. Not because she's my wife. She's giving me a hard life because she's a great lady. And Dr. Khalid can vouch for that. She is a 4-time cancer survivor who was the deputy vice dean in student affairs at the College of Medicine. When she was diagnosed after 10 years of going to the hospital and being told you have nothing wrong with you, they found her with the first cancer. So in 1999, our oncology center was not very strong. So she was sent to the United States and she saw a different life. When she came back, she told me, I want to resign from work. Can we survive with one salary? I said, yes, we'll change our lifestyle, but do what you want. So she left and started it. So I asked, why you want to do this institution? You're going to have 110 people against you. He said, it doesn't matter. I don't want any Omani cancer patient to be alone when he's diagnosed the way I was. And that's why she started the association. And it was a humble beginning. And she had lots of problems, I can assure you, of doing that. What are the, next please. This is our, I'm not going to read them because they're in front of your face and you are all literal people, alhamdulillah. This is the vision. Next one. This is our mission. And our symbol is holding hands together. We cannot do our vision without holding together. This is the reason for our twinning. This is the reason I'm pleading with all of you from different countries to join together to help the Global South issue. Next, please. These are the landmark projects. Just in a nutshell, we have the MMU, and the idea was, she said, we have a bottleneck in the hospital. the MMU should go to the 40-year-old lady in their town instead of them coming to the capital to have an MMU, because no other place in Oman had an MMU except the main hospital. And this is Oman, with a very high output of oil. But that is the problem we are facing. So now we have 3 MMUs, they are going, and they have changed the picture of cancer. Dar el-Hanan, children with cancer, they were not brought for their treatment, and because children cancer was very high in Oman, we couldn't have place in the hospital. So they were stabilized, sent home, and given 3-4 times a week to come for their chemo or radiotherapy. They were not brought in. So the doctors, our famous oncologists, blame the patient. Oh, these people, they don't bring their families. So we did an investigation and found they have no place to stay in the Muscat. They cannot afford. Some of them live 4 or 5 hours away from capital. If you have a chemotherapy, you cannot go back the same day. And even the food is more expensive in the capital than in their town. So we decided to build a home away from home. We have at the moment 16 families to stay under one roof. We give them free accommodation and transportation to the treatment center. And the idea is they have to be referred by their treating oncologist. Palliative care. We trained more than 33 countries in palliative care. We brought them to Oman and gave them basic, advanced, and trained the trainer so that they can go back to train their own people. Next, please. Sorry, there's no next, please. The genetic center I talked about. And the other thing also is the annual walkathon, which is directed to the community. And this is very important. ICPC, I talked about, I think enough, I don't want to talk anymore. And finally, I'm going to leave you with 2 slides, which have driven me, and also to sell my country, because I cannot come here without talking about my country. I will be a traitor. So we are a country of the desert. 80% of our land is desert, but it's very healthy desert. And the next one, I'll show you waterfalls as if we were in Switzerland, and they are in the same country. So come and enjoy your life. But the idea of this slide is to talk about my mentor, late Professor Pushpa Bhargava from India, from Hyderabad, who says hereditary determines what you are. Therefore, some people get cancer from hereditary, but the environment decides what you are. So what environment we do for ourselves decide what cancer is like. Next, please. Marie Curie, what did she say? She said, nothing in life is to be feared. It is to be understood. So if we go to the community and teach them about cancer, they will not fear cancer because they've understood cancer. And that's why I would like to say goodbye and come and see the waterfalls in the south region in Salalah, which are so beautiful. Thank you very much.
Thank you very much, Your Excellency, Dr. Wahid. We are running a little bit behind time, so we have time for just one burning question.
But my driver is not here.
Oh, so would you like not have a question? Would it be okay?
Okay.
All right.
Whatever you say, I do.
Okay. So seeing as there are no questions, I would like to invite again. Oh, yes, there's one. Okay.
I'd like to thank all the people who helped me with this lecture, and especially Jessica, who told me what to do and when to speak.
Professor.
Hi, thank you, Felicia. Since there's no questions, so I only have one thing to say. Dr. Wahid, right? And also to Dr. Khalid as well. Earlier, we didn't get a chance to say that. So I'm Ho Wing Kee. I'm the Wellcome Trust Research Funded Fellow at Cancer Research Malaysia. I just want to say that, our team is actually building, I'm here. So our team is actually building tools so that we can tell women what is their likelihood of getting breast cancer in the future. So what we somewhat believe is, I agree with you, a lot of it is actually coming from the women themselves. They don't perceive their risk to be high, and maybe there's a reason why they don't go to seek help or go for regular mammogram screening. So just want to let you know that, our team is working on that. We want to be able to tell women what's their risk of cancer, and at the same time also find a better way to communicate risk to the women. Maybe there's a room for collaboration, between us in Malaysia with Oman and Qatar. Thank you.
I would like you to do that, and I will introduce you about a program we are doing with New York City University. We train young researchers we train them how to write their papers so that they can be accepted in international journals. Because we have a big number of people we can work with in research, especially if the three countries work together, compared to the other people who are going in international journals with very few numbers, maximum 100 or 50, because we don't know how to do our summaries to get our researchers' papers accepted by international reputable journals. So please, we can introduce you so that you can use this, and it's a 50-hour training program, and they get a certificate at the end. So your new students can be trained.
Certainly, yes. I can speak to you more about this later if I can catch you.
Are you ready to pay?
Hey, thank
with
you very
pleasure,
much.
with pleasure, with pleasure.
Thank you, Dr. Ho. Thank you. Thank you, Dr. With your token of appreciation is on its way, we will. Yeah. Thank you very much, Dr. Wahid, and also to Dr. Santari.